Um, Good afternoon, everyone. We continue with the discussion on the sublingual veins. The sublingual veins should always form part of a routine examination of the tongue body. Under normal conditions, the two veins under the tongue are very barely visible, and they have a very faint, pale red color. When they become clearly visible, they are by definition pathological. One should observe the size and the color of the sublingual veins. So here is an example of a picture of a sublingual vein. If the veins are distended but not dark, it indicates Chi deficiency. So nagbabulge. Whereas if they are too thin in relation to the sides of the tongue and the patient's body itself, it indicates a yin deficiency. So it could be either a patient may Chi deficiency or yin deficiency. The most important sign with regard to sublingual vein is their purple color. If they are distended and dark purple, it indicates blood stasis. Usually in the upper burner, yung lungs or heart, but it may also refer to the liver. Distended and dark sublingual veins are more common in the elderly, and they give an early indication of blood stasis before the rest of the tongue body becomes probable. So, dito pwede natin observe sa sublingual veins because ito yung nauunang magkaroon ng purple coloration. Observation of the sublingual veins, therefore, has an important preventative value. Dark and dry sublingual veins indicate severe yin deficiency with empty heat. Dark swollen and wet veins indicate large lung, spleen, and kidney deficiency with accumulation of fluids. Such observation is important also in chronic painful obstruction syndrome. If the sublingual veins are reddish and shiny, they indicate damp heat. If they are yellowish, dampness, while if they are white and slippery, cold dampness. And if they are swollen as well, meron siyang dampness and blood stasis. In modern China, some doctors consider the appearance of sublingual vein as a useful prodromal sign of certain diseases. The main signs are as follows. So, pag may dark purple, there is hardening of the brain arteries. If there is a distended, dark, and crook, there is hardening of the arteries, hypertension, if the veins protrude a lot and look like earthworms. So the disease is severe, okay? If there's a small nodules like rice or wheat grains, ibig sabihin there is hardening of the arteries and heart disease, okay? Next, summary, we have the sublingual veins. If it is distended but not dark, so there is a Chi deficiency. If it is thin, there is a yin deficiency. Pag distended and dark, so there is a blood stasis in the upper burner. Pag dark and dry, it is severe yin deficiency with empty heat. Pag dark, swollen, and wet, there is a lung, spleen, and kidney deficiency with accumulation of fluids. Pag reddish and shiny, there is damp heat. Pag yellowish, there is dampness. Pag white and slippery, there is a cold dampness. And if it is swollen, white, and sticky, there is dampness and blood stasis. Okay. Pag dark purple, there is hardening of the brain arteries. Pag distended, dark, and crook, there is hardening of the arteries, hypertension. If the veins protrude a lot and look like earthworms, the disease is severe. Pag may small nodules like rice or wheat grains, there's hardening of arteries and heart disease. Okay? So normal hypoglossal veins, under normal circumstances, two thick bluish purple vessels can be seen lateral to the frenulum. Their diameter is no more than 2.7 millimeter, and their length is no greater than 1/3 the distance of the sublingual caruncle, base of the tongue, to the tip of the tongue. They have no branches, varicosities, or bulges. Pag abnormal hypoglossal vessels, the following are considered abnormal changes in the hypoglossal veins. The shape of the vein is bulging due to varicosities. The length of the vein extends past the midpoint of the length of the tongue. There's also branches of hypoglossal veins na visible or are filled as the hypoglossal veins proper. The color is darker than usual. The peripheral ends of the veins are cystic with thick round processes that may resemble a cluster of grapes. The diameter is wider than 2.7 millimeter. Indication of hypoglossal veins, abnormalities. So meron siyang chi and blood stagnation. A bluish tongue body, also a sign of blood stasis, does not always appear when the sublingual veins are distended. Even in life-threatening diseases such as metastasizing carcinomas, which are commonly accompanied by chronic stasis of blood, the tongue body color may be unchanged with no blue discoloration. In these cases, however, the sublingual veins are frequently distended. Okay, so yan po yung metastasizing carcinomas. According to Mashoshia, distended sublingual veins that appear in combination with normal tongue body color as an early indication of chi and blood disorders. This can be further expanded upon. So many women with uterine fibroids or positive pap smears often have tongues with normal body color and shape but with severely distended sublingual veins. So pwede natin ma-observe yung normal yung sa tongue surface, however, there is severely distended sublingual veins. The veins are also visible when the penetrating vessel is afflicted with long-standing blood stasis, resulting, for example, from sexual abuse or multiple abortions. However, if the sublingual veins are thin and light in color, the blood stasis is not very serious. This diagnostic evidence should be taken into account when examining patients who suffer from menstrual disorders, habitual miscarriages, or infertility. Okay. Injuries such as bone fractures or torsions of the sinews, tendons, or muscles interrupt the circulation of blood, resulting in localized stagnation of blood in the channels, muscles, and joints. This type of blood stasis is superficial and usually found unilaterally. It may present on the tongue as a unilateral distended sublingual vein. So pag mayroong ganitong mga injuries, pwede rin natin ma-observe sa ating distended sublingual vein. Again, this sidedness of the injury and of distended sublingual vein may not coincide. So if we could observe these distensions sa sublingual vein, it doesn't necessarily mean ng same side po yung injury. Accumulation of phlegm or damp heat in the body can also be observed in the sublingual veins. In this case, they are reddish blue and have a sheen. Other signs include blue, black, or dark spots. These signs are indication of heart blood stasis that manifest as coronary heart disease or illness of the liver such as chronic hepatitis, cirrhosis of the liver, or liver cancer. So Example ng tongue. So we go to a case of a male, 38 years old. So yung tongue po niya is red, swollen, yellow, greasy, dry coating. So yun po yung tongue surface with heat. Ibig sabihin, there is heat in the liver with long-standing retention of damp heat in the liver and gallbladder. There's also red, slightly bluish sides, blue distended sublingual veins. Okay, so observe po natin yung sublingual veins. Ibig sabihin, there is a liver blood stasis. Sa symptoms ng patient, there is epigastric fullness, sharp pains in the right hypochondrium. There's a fatigue and muscle pains. Sa Western diagnosis, hepatitis C for 13 years. And sa background to disease, heroin and alcohol abuse. Okay. Next patient is a female, 31 years old. The tongue of the patient is reddish and slightly narrow. So there's an onset of kidney deficiency. There's also a red tip. So there's heat in the heart, and there's a thick blue tortuous sublingual veins. Okay, so there's a blood stasis in the womb. So symptoms of patient, painful menstruation, night sweats, insomnia, depressive moods, and fear. Sa Western diagnosis, there is a cervical cancer. And sa background to disease, long-standing emotional problems, extreme mental demands at work. Okay. Sa case history, Mrs. M is a 31-year-old archaeologist. Her work included frequent travel, which contributed to an irregular lifestyle. Irregular eating habits, insufficient sleep, and unsatisfactory personal relationship all contributed to her feeling unwell. She was constantly exhausted and suffered from depressive moods. Over a few months, the length of bleeding and the intensity of her menstrual cycle changed. So she decided to visit a gynecologist. The finding was cancer of the cervix without lymph node involvement. Her tongue showed a very red tip and thick blue distended sublingual veins. Her pulse was thin and frail. Okay. Sa analysis, the irregular lifestyle and lack of sleep were responsible for a slight weakening of the kidney yin. This was accompanied by liver qi constraint, possibly caused by the emotional instability of her personal relationship. Manifested in strong mood swings that vacillated between anger, grief, and fear. The kidney deficiency, as reflected in the small tongue body, was responsible for the night sweats and sleeping problems. The red tip of the tongue indicated heat in the heart that was caused by the long-standing emotional problems, as well as the underlying slight kidney deficiency. The thin, frail pulse reflected the underlying deficiency of yin and blood. The long-standing liver qi constraint often leads to a pattern of liver blood stasis, which in turn means the circulation of blood in the penetrating vessel. The result is a pattern of blood stasis in the womb, which in this case is visible in the thick and swollen sublingual veins. This suggests a long-standing pattern of blood stasis, which may be responsible for the cellular changes found in the cervix. Okay. The discussion in many cases, distended sublingual veins are indicative of an ongoing process of blood stasis in the body. Although some research suggests that the appearance of these veins is a sure sign of disease affecting the heart, lungs, and liver, diagnosis using the sublingual veins does not always allow one to determine the exact location of the blood stasis in the body. This must be determined with the help of the other presenting symptoms. In general, a valid interpretation of the severity of the blood stasis can be made based upon the appearance of these veins. Previously stated, the severity of the blood stasis is reflected in the intensity of the color and the degree of distention and swelling of the veins. As one would expect, thin, bluish, distended sublingual veins are indicative of mild blood stasis. Okay? So, hanapin po, titingnan natin yung thin, bluish, distended sublingual veins. Okay? So, yan yung blood stasis. Next, we have a case of a female 42 years old. The tongue is reddish, slightly contracted tongue body. So there's a presence of kidney deficiency. There's also red in the anterior third with red points. So yung sa harap ng tongue. So there's heat in the heart. There's also coating without root. So there is presence of stomach and kidney deficiency. There is also dark blue distended sublingual veins. So meaning there is a liver blood stasis. Patient symptom is severe hair loss, fatigue, sense of fullness in the right hypochondrium. So Western diagnosis, there is malignant hepatoma. And sa background to disease, use of contraceptive pills for 18 years. Okay. Next patient is a male, 83 years old. The tongue is dark red, small, and shiny. So there's a presence of lung, stomach, and kidney deficiency. There's also a dark purple sublingual veins with dark spots. So there's a severe blood stasis in the upper burner. Patient symptom is dry cough, night sweats, low-grade fever, intense feeling of heat in the body, labored breathing, and shortness of breath, exhaustion. So Western diagnosis, there is a chronic bronchitis, emphysema. Background to disease, heavy smoking for 60 years. Okay. Next patient is a male 66 years old. The tongue is red, firm tongue body, which is, there is a kidney deficiency. There's also a rootless coating, especially at the center and the root of the tongue. Okay. So there's a presence of stomach and kidney deficiency. There's also a slight yellow old coating. So there is retention of damp heat in the large intestine, and there is a thick, dark blue, distended sublingual veins with dark spots. So there is a severe blood stasis. Patient symptoms is long-standing constipation, heartburn, stomach pain, extreme physical weakness, night sweats, pain in the bones. So Western diagnosis, prostate cancer with metastasis to the bones. Background to disease, overwork, and emotional problems. Next patient is a male, 33 years old. The tongue is pale red, swollen in the anterior third and center of the tongue. So there's a sphincter deficiency with retention of phlegm. There's also a red points in the anterior third. So there's heat in the lungs, and meron siyang yellow greasy coating at the root of the tongue. So there's retention of damp heat in the lower burner. Sa sublingual veins, meron siyang blue, very distended sublingual veins with branching bright red capillaries. So there's a blood stasis in the upper burner with the development of toxic heat. Sa patient symptoms, there's cough with blood tinge, sputum, pain in the chest, night sweats, constant low-grade fever, thirst, and nausea. Sa Western diagnosis, inoperable bronchial cancer. Okay. Sa background to disease, smoking 40 cigarettes daily for 15 years. Thank you for your attention.